as we consider anxiety, the first area I like to consider, the first area I like to look is the structure of the body. Is there structural compromise happening? We need to realize that by age 13, on average, your child has suffered from 1,000 traumas. 1,000 traumas by age 13. Well, they're just an active child, parents say. Well, he just likes to, he likes to play. He plays hard, they say. But again, we need to realize that by age 13, 1,000 traumas, there's something going on there. And as we traumatize our body, and understanding that your body is controlled by nerves, 20% of those nerves control pain, and 80% control function. We don't always have pain when we suffer a trauma, but we can have neurologic compromise. Here's one of the most important things structurally I think we need to consider for anxiety. When we have a trauma, a lot of times we can damage nerves that are responsible for telling your brain where your body is and what it's doing. Now, ideally, that would lead to symptoms of uncoordination, of balance issues, of equilibrium problems, and sometimes it does, but not always. Sometimes it leads to decreased sensation in the brain, decreased sensory integration in the brain. Your brain needs to know where you are. Again, to keep you upright and balanced, of course, but beyond that, it needs to know where you are so that the brain can understand what you need to do. For example, your brain is in a constant state of prediction. Right now, my brain, as I look around my office, it's predicting, right? If I need to stand up, walk around my desk, and go out my door, my brain has predicted what needs to happen for me to do that. I need to stand up, I need to move, I need to use these muscles, I need to use this amount of strength, I need to move this many steps. My brain predicts that. If I've had compromise to the nerves that attach to my muscles and the nerves that attach to my tendons and my ligaments and my joints, then that prediction cannot be made properly. Again, that can lead to balance problems, equilibrium problems, coordination problems, but also it leads to a kind of ungrounded feeling inside the brain. And it can lead to stress inside the brain. And when we have stress response inside the brain, we feel anxious. I'll be honest with you, when I assess kids in my office, specifically those for anxiety, probably 80 to 90% of those kids have some sort of structural compromise, some sort of structural issue, leading to the miscommunication of nerves to the brain, causing that ungrounded feeling inside of the brain